So the first question that I received was from Amanda Zepke Haldeman, and it says, my 30-pound, 5-year-old border collie just had stem cell treatment to help repair a 5% cruciate tear and help with osteoarthritis in the hip. She also has a grade 1 iliopsoas strain. Isn't that a surprise? We don't ever hear about that happening with agility dogs, do we? By the time of the party, I'm not sure if that's what she meant, but that's what came up. We will have started PT, including laser and chiro. Are there any herbal supplements you would also suggest? She will be starting on Dasuquin Advanced, hoping to get the cruciate and psoas sorted out and then deal more long-term with osteo in the hip. Well, it sounds like there's quite a bit going on with that dog, and of course it's all related. You know, the osteo in the hip is related to the CCL deficiency, is related to iliopsoas in a great big circle. One thing doesn't happen separate from the other. But it sounds like you're well on the way of taking the right steps to help her out. So let's see, you repair 5% cruciate tear and any herbal supplements. Well, the herbal stuff is a little difficult to prescribe because some of it is more specific for an individual constitutional, especially when I do traditional Chinese medicine. But you can do like MSM, glucosamine, which obviously you're going to do that when you start on the Dasuquin Advanced. The Dasuquin products are not one of my favorite products to use. I think they're a little bit overpriced and a little bit underpowered, and I actually, for working dogs, like to use other products. I like to use Springtime's Fresh Factors. Sometimes we'll use the equine ones in dogs. You can also kind of pick and choose how you want to make something work. So I'll tend to do something that has glucosamine, chondroitin, vitamin C, HA, which is hyaluronic acid, some of the antioxidants, and MSM. If you have a 5% tear, I definitely recommend you do something that has as much MSM as possible. Also, if you're doing PT and laser and chiro, that's an excellent way to start. Make sure that your chiropractic veterinarian understands how to do fascial work, and make sure that there's some soft tissue work that's going on in there as well, not just straight chiropractic and just adjusting things and moving on. It sounds to me like there needs to be a lot of soft tissue work that needs to be done on this dog, myofascial as well as fascial. Maybe someone who does some twee-naw. And I would add some acupuncture to this. Get after the osteoarthritis in the hip right now because it's part of the whole picture, so you might as well try to manage it all. And I would have, see if you can find whoever your rehab vet is or whoever is doing your acupuncture. Make sure that they do traditional Chinese medicine and maybe get some herbs from that person. So I would tend to look for someone who's done the acupuncture course either through IVIS or someone who's done the acupuncture course through the Qi Institute, and visit with them and maybe get started on some herbs that way too. That's going with Chinese herbs versus going with Western herbs. You can also do on the Western herbal thing, you can do some of the anti-inflammatories. Boswellia, frankincense, Boswellia is Indian frankincense, and it acts as a little bit of an anti-inflammatory. Yucca, willow bark. But I tend to like to do more of a whole body type of a thing, kind of the Chinese perspective, and not just throw Western herbs that would work the same way as Western drugs at something like this. So I'd rather you kind of do the laser, the chiro, some acupuncture, and maybe find someone who does traditional Chinese herbs. Hope that helps.